Hello, Suzanne with Dawning Visions Hypnosis. I'm wondering how many of you are feeling overwhelmed by the huge responsibility you have for each of your patients, especially if you're dealing with patients who have very serious mental health issues. And given the fact that if one of them chooses to, well, I don't know any easy way of saying this, but suicide themselves, maybe you feel rather uncomfortable with that whole proposition. This was indeed a situation that one of the YouTubers stated as to why he left practice. He didn't want that responsibility. He didn't want to have to be concerned about what his patients were going to do, which he had absolutely no way of controlling. Because the reality of the situation is, if a person gets it in their head that they want to kill themselves, they will. For them, they're in so much pain, it's relief. We can only do what we can do. That's it. So maybe you're feeling the burden, the pressure of maybe having a few or even several patients who might fall into that category. Maybe it's time for you to think about how you can do your job and do it with people who you don't have to have that concern about. In fact, if you're running your own practice, it's really better for you to niche it to a certain type of person based on psychographics and demographics. And just choose one specialization and market to that. Make your marketing a whole lot easier, and you'll attract the people that you want, and you'll be able to charge more money because these are the people who know that you're the specialist in that specialty. Especially if you have some stories that you can tell regarding how you helped patients in similar situations. It's all very important. I know that over the years, my practice in hypnotism has changed a lot. When I first got in, I was working with people who were underemployed or overemployed because it took me 21 years to find my profession. Yes, it did. And then it moved on to a gentleman who called because his son was being labeled a pedophile, even though the kid was only 16 years old at the time and never had intercourse with anybody. Go figure. And he had gone through the trainings that I had gone through. Well, one training at that time with my NLP practitioner, and knew that timeline therapy would definitely help him deal with his anger and sadness issues. But we had a lot deeper issues to deal with than just that. That was the beginning of the treatment that I did with his son. And his son is doing very well now. And that was back in 2005. He's all grown up and even raising a child of one of his friends who was diagnosed with cancer and is dying and can no longer take care of the child. Talk about a turnaround, huh? Because many times what someone sees as an impossible situation, when you hold the possibility for actual healing and you understand the foundational reasons why the person's doing what they're doing, you can help them heal. This particular client had 6 different diagnoses, was on 6 different kinds of medications and needed none of it. And none of the diagnoses fit, really. He was just acting out of anger. But nobody, in all the years, he was an inpatient from the age of 5.5 until 16, almost 17, when he saw me, nobody asked him why he was so angry. Nobody. He found that out during the detailed personal history during his first session with me. Yeah. He felt his mother abandoned him when, in fact, what happened was she died of AIDS when he was 6 months old. No one told him that story, including his adopted parents, for whatever reason. He found out we were able to help him heal it, and he was able to come off all his medications, leave the program, and doing so well. It wasn't easy, but it happened. 15 hours, 3 sessions, and a lot of loving care from his parents, adopted parents. So, what are you willing to learn in order to help your patients truly heal? I'll tell you this, I offer a 2-day VIP program to teach mental health professionals how to do exactly what I have learned how to do. Hypnosis and neurolinguistic programming. You can do it in a weekend, Saturday, Sunday, the comfort of your own home, online, one-on-one, with a 12-month mentorship. So you too can actually help your patients heal instead of being stuck in a mental health system that doesn't believe that they have the ability to heal, which is utter garbage based on my 20 plus years of experience helping my clients heal. Oh, so many things. From depression, anxiety, to sex addiction, to drug addiction, but I don't do that anymore, to obsessive compulsive disorders, to anorexia, as long as they have a healthy weight. I just deal with the mental health part of it. Bulimia, and more. No meds necessary. They just need to know that someone is holding the opportunity for them to truly heal and has the skills and the abilities to help them heal, because all we can do is facilitate their healing. When you're able to choose your patients, you no longer have to worry about whether or not you're going to commit suicide under your watch. Yes, indeed. So if you're interested in learning more about that program, I will have my contact information in the description box below, and we can connect and schedule a free consultation call to see if that's something you'd like to pursue. That's all I have for you for now. As long as I thank you for spending your time with me. Till next time. Bye-bye, all.